Good afternoon, Mr. John Lampert. Joe DiGirolamo. How are you doing today, sir?
I'm doing well. Nice meeting you.
Nice meeting you as well. I just want to confirm your date of birth.
November 18th,
November 18th,
1948.
1948. Excellent. And the medical assistant came in and had taken your blood pressure and a number of other vital signs. They are absolutely excellent. Blood pressure 118/68. Your heart rate is 68. Your breathing 16 breaths per minute. Your temperature, no fever, 98.1. And your O2 sat, your oxygen saturation on room air without oxygen, is 98%. And do you have any pain currently at all?
Not at all, no.
All right. I understand that your chief complaint is hearing loss, right ear.
It is my right ear. It happened maybe a year ago, in 2017, around May.
Yes.
I was at the shooting range.
Yes.
And I did have ear protection, but I took my ear muff off, and I also had earplug.
Yes.
I was unaware that the earplug came out, and the gentleman that I was with fired off 2 rounds, and since that time I have had some major hearing loss in my right ear.
Okay. What I'd like to do is a comprehensive assessment of your head, ears, eyes, nose, throat, and mouth.
Okay.
So what we'll do is we'll begin with the head. I'm just going to take a close look at your scalp and your facial, your face, and so forth. So
Okay.
if you don't mind me standing.
No,
okay, thank
fine.
you. All right. All right, excellent. So you have very thick head of hair. Excellent. I don't see any lesions at all on your scalp, and no unusual hair loss or receding. I just want to take a close look at your face here. No deviation in the septum. Everything is symmetrical. And if you don't mind, I am just going to take a look at your eye here. All right, excellent. All right, look up, look down. Okay, very good, excellent. All right, there's your sclera are white and clear. Look up, look down. Okay, perfect. All right, and can you smile for me? All right, with your mouth open. All right, excellent. All right, excellent. Everything is symmetrical. And I just want to take a look at around your ears here. Okay, I don't see any nodules or lesions. Do you have any pain or tenderness anywhere?
I do not.
All right, and I'm just going to look at your left ear as well. And any pain or tenderness?
No.
All right, and I don't see any nodules or lesions. Perfect. Just going to check your sinuses real quick. Do you have any pain or pressure?
No. No, sir.
Okay. How about any pain or pressure here?
No, not at all.
All right. What I'm going to do is just have you stand. And if you can gently bend forward. Do you have any pain or pressure on your sinuses?
I do not.
And you can sit back down, please. All right, so that's our head and facial examination. We're going to move on to the eyes now.
Okay.
Mr. Lampert, I'd like to take a closer look at your eyes.
Okay.
Have you had any pain or in your eyes, or do you see any floaters in your eyes?
Nope.
Blurred vision at all?
No, but I do wear glasses.
You do wear glasses. Okay, excellent. And those are the glasses you actually gave me to hold as
Yes.
you came in.
Yes.
Okay, so I'd like to do a visual acuity test on you. May I give you back your glasses?
Okay.
You need your glasses to see far away, and also...
Actually, more printing that's closed up.
Yes.
Okay. Further away, I'm much better without my glasses, but actually I wear them for both distance and up close.
Okay, so your prescription are for distance and up close.
Yes.
Okay, excellent. So if I could have you put those on, and I am going to actually have you stand. If you can stand, yes, exactly. I will have you cover your right eye. We're going to have you cover your right eye. And with that being said, what is the lowest line that you can read?
Well, I think the last one, LTFPN.
Excellent. Okay. Now, what I'd like you to do is cover your left eye. What is the lowest line that you can read?
Actually, the line before that, which would be EPTZO.
Okay, excellent. So, Mr. Lampert, your left eye, you have 20/20 vision in your left eye, you have 20/30 vision in your right eye. What I'd like you to do is, with both eyes, what line can you read best?
Oh, the last one, LTFPN.
Okay, you actually, it is 20/20 minus 1. Are you able to read the line up above?
I think that would be a CFDNJ or HJ.
Excellent, excellent. All right, with that being said, if I can have that back, we'll have a seat, if you will. Okay. And with your glasses off, what I'd like to do is just take a look at your pupils, the reaction of your pupils, okay? And just stare straight ahead. There's going to be a light shining in your eyes momentarily. All right, excellent. The pupils are equal, round, and reactive to light. That is excellent. Now what I'd like to do is actually test how your eyes converge, and also test the muscles in your eye. Okay, so what I want you to do is, just with your eyes, follow my pen light.
Okay.
Okay, excellent. I don't see any nystagmus. That is excellent. No dysfunctional glaze at all. Very, very good. And 2 more times. You're doing excellent. Perfect. Okay, that concludes that part of the test. Now, I would like to take a close look in your eyes with my ophthalmoscope. Okay. So again, you're going to have some a bright light in your eye, and I'm just going to sit to your side here, put my glasses up, and bear with me here. All right, I see the orange in the pupil. I'm just going to look in the back of your eye and your optic disc. A nice yellow orange. I do see your optic cup, which is a yellowish white and about half the size of the optic disc. I'm just looking at your vessels in the back of your eye, your arteries and veins. I don't see any edema or any type of clots. Excellent. Everything looks good on the right eye. I'm going to do the same on the left, if I may. I apologize.
No, go ahead.
Okay. Alrighty, again, same thing. Alright. Okay, very good. I'm just going to hold up your brow. Okay. Same thing. Okay. Optic disc looks good. Your cup. Vessels in the back. Okay. Excellent. Everything looks good in the left eye.
Good.
So now that I looked at the vessels in your eye, what I'd like to do is just check your field of vision, okay?
Okay.
So with that being said, I'm going to have you close. What I want you to do is actually look for movement in my fingers, okay? I want you to close your right eye at this time. All right, and let me know when you see movement.
Right there.
Okay. Let me know when you see movement. Okay, excellent. And let me know when you see movement. Excellent. Good, excellent. Now with the other eye closed, okay. Again, let me know when you see my fingers move. Let me know when you see my fingers move. Good. And let me know when you see my fingers move. Okay. Let me know when you see my fingers. Good, excellent. So that concludes the eye examination, part of the comprehensive examination that we're doing today. Now we'll move on to the ears.
Okay.
Okay. Okay, Mr. Lampert, what I'm going to do is actually take a look at inside your ears.
Okay.
We already inspected the outside of your ears, and everything looks good. But I'm going to come over to this side here and take a close look. Let me know if I'm hurting you here, okay?
I'm good.
All right, excellent. Very clean ears. I don't see any drainage, any blood. You say you've been having hearing problems for the last year now with the right ear.
Yes.
Okay. And I see that you have some ossification here in the right ear. Okay. What I'm going to do is take a look at the other side now. Just come along around to the other side. Thank you. Okay. And if I'm hurting you, let me know.
Okay, no, you're good.
All right, this one looks good. Perfect. Okay. Excellent. All right. So what I'd like to do is I'm going to conduct what's called a whisper test, okay?
Okay.
So I'm going to stand behind you, okay? And standing behind you, I am going to be whispering on your right side, okay? In the meantime, I'm going to put one of my fingers in your left ear and just massage your ear here, just so that we're getting an accurate assessment of your hearing on the right side, okay? And we'll do the same for the other side as well. And I'm going to say letters and numbers, and if you can repeat them, do so. Ready?
Go ahead. I got nothing.
Let's try again.
Yeah, I know that you're whispering something because I can hear the whisper,
Yes.
but I cannot make it out.
Okay, let's try the other side. Same thing.
Again, I can hear the whisper better, but I still cannot make it out.
Let's try again.
I think I heard an O, a 1.
Excellent.
But that's
okay.
it.
All right. So we definitely have to delve into this further. What I'd like to do is just get my tuning fork out. I'm going to test your hearing conduction. I'll be placing this the tip of this tuning fork on your in the center of your head here, and let me know what side, if any, you can hear the vibration.
Okay.
Okay, ready?
Nothing over here, but I do hear it on this side, on my left side.
Okay, so you do hear it on the left, but not on the right.
Mm-mm.
All right, now I am going to test, again, your hearing in a different way, your sensory neural hearing. Again, what I'm going to do is put the tip of this behind each ear, one at a time,
Okay.
okay? Let me know when you stop hearing the noise,
Okay.
and then I'll move it to the side of your ear, and let me know when you stop hearing a noise.
All right.
Okay, and we'll do that for both sides.
Okay.
Ready?
Yeah. Stop. Stop.
Okay, excellent. All right, that is within normal limits. You heard the sound longer outside the ear than actually placed directly on the bone.
Okay.
On the left side, let's do the same thing for the right.
Stop. Stop.
Excellent. So you definitely have conductive hearing loss on the right. I would like to move on to the inspection of the nose now, if I
Sure.
may.
Okay.
Okay. Mr. Lampert, now what we're going to do is take a closer look at your nose, but inside your nose.
All right.
Just looking for any deformities, drainage, bleeding. Have you had any sinus related issues recently?
I haven't had any that I can even think of.
All right, may I look up your nose?
Sure.
All right, excellent. Okay. I don't see any drainage at all. Okay. And I don't see any deviation of the septum. Perfect. All right, now what I'd like to do is actually take a close look inside your mouth, if I may.
Sure.
I'm just going to get some hand sanitizer and some gloves, as well as like a tongue depressor to help me,
All right.
okay? So bear with me while I get my gloves on. And what I'm looking for is like any ulcers or any blisters. Have you had any bleeding of the gums or ulcers or canker sores or anything like that?
Now, occasionally at night I bite my tongue
Okay.
while I'm sleeping, but other than that, no.
All right, excellent. Okay, so with that being said, I'm just gonna look back. All right, any sore throat at all? I don't see any swelling back there. Just gonna look at the side of your mouth. The mucosa looks good. Pink, fleshy color. Perfect. I see that you have some fillings up top here.
Mm-hmm.
Okay. And they extracted a rear lower molar on the left side, I see.
Mm-hmm.
I don't see any cavities. Your teeth are very nice. And just looking up top here. Okay. Don't see any ulcers at all. Okay. And your front teeth are capped?
Yeah.
All right. Excellent. Just lift up your tongue. Good. Excellent. Perfect. And just mucosa looks good there. And stick your tongue out. Good. It's symmetrical. Very good. And just relax. Swallow. Perfect. Now what I'm going to do is just how often do you see the dentist?
Oh, at least once a year, sometimes twice, usually for cleaning.
Okay, excellent. It's great that you're seeing the dentist at least once, preferably twice a year. And also, I forgot to ask you, how often do you have eye appointments?
Oh, yearly? Actually, yearly at 2 years.
Very good. All right. So with that being said, I'm going to get hold of your tongue with this, and I'm going to just look for any ulcers or lesions here. Okay. Just move your tongue to the side. I don't see any ulcers or lesions. I don't see any ulcers or lesions there. All right. Excellent. Very good. All right. With that being said, we'll move on to checking your lymph nodes as well as your thyroid.
Okay.
Okay. Mr. Lampert, what I'd like to do is just palpate your trachea, your lymph nodes, and so forth like that. So if I could just have you lift, I'm just going to touch under here. And all right, your trachea is midline, and I don't feel any distension in the vessels. That is excellent. That is perfect. Now, what I'd like to do is just feel your lymph nodes throughout. Okay, in front of the ears here. Any pain where I'm touching?
No.
Okay, I don't. Any tenderness?
None whatsoever.
All right, excellent. I don't feel any nodules, real firm nodules that are solid. How about behind the ears here? Any pain or tenderness?
Nothing.
All right. Any pain or tenderness here?
None whatsoever.
Okay. How about here?
Nope.
All right. And how about here?
No.
All right. Now along your neck area here, any pain or tenderness?
None.
All right. I'm just palpating the lymph nodes. Okay. Any tenderness here?
Nope.
Okay. And how about at the base of the neck here?
None.
No tenderness here?
None whatsoever.
All right. What I'd like to do is actually check your thyroid.
Okay.
Okay, so in order to do this, I'm just going to have you sip. This is a glass of water. If you could just swallow some water. Okay, excellent. What I'm going to do is I'm going to stand behind you. I'm going to feel for your thyroid behind you, and then I will have you swallow. Okay?
Yep.
All right, excellent. All right, I just want to feel for the cricoid process here. All right, now with that being said, Mr. Lampert, I just want you to put your head forward a little bit, forward just like that, and just relax your muscles. And can you swallow some water? Excellent. All right. I don't feel any goiter. I don't feel any nodules. And have you had any issues with unusual weight loss or gain?
No.
Or dryness of skin or hair?
Nope.
Oiliness of skin or hair?
I'm good.
All right. So what I'd like to do is actually refer you to a specialist for the hearing. You do have conductive hearing loss in your right ear, as you were well aware, and you understanding that a third of the population, 50 years or older, actually has progressive hearing loss, and that's due to the natural degeneration of the hair cells within the ear. But there's other things that can contribute to hearing loss, and that's hazardous noises. And you said you were exposed to gunfire.
Yes.
Without proper hearing protection.
That's true.
So I would like to refer you to a specialist to more closely examine, and perhaps you may even consider a hearing aid for that ear as well. But I'll let the specialist direct you.
Okay.
Okay. At this time, do you have any questions or concerns, Mr. Lampert?
No, other than if when you looked in this ear, did you see anything that might be severe, so severe that a hearing aid may not take care of it?
I didn't see any bleeding. I didn't see any perforation of the eardrum. There may be some calcification, but that usually is not necessarily a significant finding. But obviously there is some, based on the test that we conducted today, there is conductive hearing loss, and I would feel more confident in your care if you were to see a specialist.
Okay.
All right?
I understand.
All right. Thank you very much.
No, thank you very much. So I'm in good shape for the shape I'm in.
You are definitely in good shape.
Thanks.
Yes.
Thank you very much.
Thank you.